with medicine, with social aspects, nothing about religion. In fact, I've never talked about religion in all my presentations, all my anti-RH speeches all over the country. But let me tell you this, 4244 is not anymore necessary. Why? Because the bulk of the reproductive health care being mentioned in House Bill number 4244 are already present, almost verbatim, in an existing Republic Act. This is Republic Act 9710. The Magna Carta for Women. For example, I'll show Section 17. What are the comprehensive health services mentioned in Section 17? Maternal care, promotion of breastfeeding, responsible, ethical, legal, safe, and effective methods of family planning, family-state collaboration in youth sexuality education, prevention and management of reproductive tract infections, prevention and management of reproductive tract cancers, prevention of abortion and management of pregnancy, violence against women, care of elderly women, prevention and management of infertility and sexual dysfunction, which is not a problem here in the Rotary Club of Manila. But let me show you how House Bill number 4244 compares with Republic Act 9710. Number one, House Bill number 4244 talked about maternal, infant, and child health and nutrition. 9710 talked exactly of the same thing. Maternal, prenatal, postnatal, promotion of breastfeeding. House Bill 4244, family planning. Section 97, Republic Act 9710 talked also of family planning. The RH Bill talked of prescription of abortion. 9710 talked of prevention of abortion and management of complications. Letter D, RH talked of adolescent and youth reproductive health. 9710 talked of basically the same thing. Letter E, the RH Bill talked of prevention and management of reproductive tract infections, HIV. 9710, Republic Act 9710 talked also of prevention and management of reproductive tract infections, including STI, HIV, and AIDS. Exactly the same thing, but practically copied from the Republic Act. Elimination of violence against women, 9710 also talked of violence against women. Letter G, education and counseling on sexuality and reproductive health, 9710. The Magna women talked also of health information and education. RH Bill talked of treatment of breast and reproductive tract cancers and other gynecological conditions. Republic Act 9710 talked exactly the same thing. Prevention and management of reproductive tract cancers like breast and cervical cancers. The RH Bill talked of male responsibility and participation in reproductive health. The RH Bill, the 9710 also talked of, the reproductive health bill talked of treatment of infertility and sexual dysfunction. Republic Act 9710, an already existing law, also talked of prevention and management of infertility and sexual dysfunction pursuant to ethical norms. Letter K, reproductive health education in the RH Bill. In the 9710, an existing Republic Act, also talked of sexuality education, etc., etc. So you can see that practically all of these measures that are being proposed under the RH Bill are already in an existing law, Republic Act 9710. And I think the only difference here is that some people would like to repack something, copy something, in order to say that it's their own idea. When in fact it's already existing. It's no different from a congressman, for example, that will be repacking relief goods coming from the Rotary Club of Manila and then wrapping it and then projecting it as his own. It's already existing. So, in other words, ladies and gentlemen, my friends in the Rotary Club of Manila, my friends for more than 30 years in the Rotary Club of Manila, this bill is superfluous, it's unnecessary, and therefore it should be junked because it's not anymore needed. It's already there. And we are not against it. If we're talking of population control, for example, it's already been handled by the Population Commission since 1969. All that is needed is to maybe increase their funding, and I have nothing against that. I'm not against that. What I'm against is the allocation of 3 billion pesos worth of money, hard-earned money, that can be better used in order to improve the economic strategy of our country, maybe better schools, more school buildings, better health facilities, etc., etc. Now, let's talk of population. You know, when we speak of population, we cannot talk of population numbers in absolute numbers, because 125 million in Canada, for example, is not equal to 125 million in the Philippines. Let's talk of population density. I'll show you the chart of the top 10 countries by population density, plus maybe 2 more, compared to the Philippines. The Philippines has a population density of about 266. Maybe let's call it 300, just to round off the figure. Macau has 20,000 persons per square kilometer. Hong Kong has a population density of 6,571. Singapore has a population density of 5,539, more than 10 times the population density of the Philippines. And if we're talking of something really comparable, we started the economic journey at almost the same time. Taiwan and South Korea both have a higher population density, but in spite of that, they were able to achieve so much as far as their economic development is concerned. And the reason for that is, number one, because of correct national leadership, and number two, because of correct economic strategy. It has nothing to do with population density. Population density was not an obstacle as far as they were concerned. It became an obstacle for us as far as the RH people are concerned because of the wrong economic strategy. 3 billion pesos in order to prevent the birth of about 200,000 babies per year. You give me 3 billion pesos, I'm going to allocate that to Tesla, for example. With 3 billion pesos, I can train about 200,000 young, able-bodied Filipinos, and the 200,000 can generate, I made a little computation, about 40 billion pesos additional income, additional input to our GDP. The 3 billion for condoms, for contraceptives, where will that go? Down the drain. In fact, a lot of people are already saying that in the DOH, there's a lot of corruption because of all the funds that are allocated for this that are right now missing to the tune of about 700, maybe 400 million pesos. So why add to the existing corruption in the Department of Health? Again, as far as population density is concerned, the wealthiest localities in the Philippines are those that have the highest population density. In fact, as a general rule, the poorest provinces and localities in the Philippines are those with a very low population density.